Bismillahirrahmanirrahim. Let's start with the quote of the day. There are two ways to live a pleasant life, either in someone's heart or in someone's prayer. Today, the topic of my presentation are snake bite, dog bite, theories of health communication and promotion. Assalamu alaikum, everyone. I am Dr. Amna Khan, PGR, MPH, Community Medicine Department, KEMU. I'll be giving this presentation under the kind supervision of my most honorable, most respectable supervisor, Professor Dr. Saira Afzal. Today, the learning outlines are snake bite, epidemiology, prevention, treatment, dog bite, epidemiology, prevention, vaccination, theories of health communication and promotion, recent updates, and MCQs. Learning objectives. At the end of this presentation, participants will be able to describe about the snake bite, dog bite, overview of the theories of health communication and promotion. Let's start with the snake bite. A snake bite is an injury caused by the bite of a snake, especially a venomous snake. Envenoming can also be caused by having venom sprayed into the eyes by certain species of snake that have the ability to spit venom as a defense measure. According to WHO, snakebite envenoming strategy for prevention and control has the goal to decrease it by 50% by 2030, empowering and by strengthening the health systems, by increasing the partnership and coordination, empower and engage the communities, and by ensuring the safe, effective treatment. The available data shows epidemiology. The available data shows 4.5 to 5.4 million people get bitten by snake annually. Of this, 1.8 to 2.7 million develop clinical illness, and 81,000 to 138,000 die from complications. Types of snake bites. There are two different types of snake bites, dry bites and venomous bites. The dry bites occur when a snake doesn't release any venom with its bite, and the vice versa. Types of venom. Cytotoxins, neurotoxins, myotoxins, anti-clotting agents, and hemorrhaging. Classification of snakes. Snakes are classified into poisonous and the non-poisonous snakes. The poisonous snakes are elapids, vipers, and sea snakes. Elapids secrete neurotoxic venom. Vipers are vasculotoxic. Sea snakes are myotoxic. Now the symptoms. So generally the symptoms are categorized into the local effects, myotoxicity, hematotoxicity, neurotoxicity, cardio, and the nephrotoxicity, depending on the bite by the snake. So if the bite is by a viper snake, the local effects would be blistering, swelling, necrosis. The myotoxicity shows rhabdomyolysis, myonecrosis, and the muscle spasms. And there will be hemorrhaging and vasodilation as well. Neurotoxicity is relatively rarer, and cardio and nephrotoxicity would show acute kidney injury, hypovolemia, and ischemia. In the case of a bite by a lapid snake, the local effects are relatively rarer. There will be rhabdomyolysis and myonecrosis. Hematotoxicity is rarer. Yeah, but the most important thing to notice is there will be difficult breathing, flaccid paralysis, and respiratory failure here. Cardio and nephrotoxicity is rarer. Mechanism of spread is via the lymphatic system. The preventive measures. How to avoid snake bite? Wear a closed pair of shoes while going out. Always use a torch at night. Look where you put your hand or foot. Avoid sleeping on the floor and use a well-tucked mosquito net. Keep home and surroundings clean and clutter-free. Control rodent population. Prevent snake bite, save life, create awareness in communities to prevent the snake bite. Now the do's and don'ts. Snake bite first aid. Do's. Bitten by a snake, call the ambulance, call for help. Immobilize the victim, remove belt, jewelry, watch, rings, etc. as the bitten area may swell. If ambulance is delayed, rush to the nearest hospital using any mode of transport. Transport the victim lying on left side, right leg bent, and hands supporting the face. Patient will breathe better and not choke on vomit. Inform the doctor details of the bite. Antivenom is the only cure. Don'ts. Do not panic. Snake bite is a treatable condition. Say no to the faith healing. Do not try to kill or capture the snake. Do not cut or suck the bite area. Do not lie a tourniquet, apply ice or massage the bitten area as it causes further damage. Do not self-medicate or apply any herbs or spices. Nothing helps. Treatment of venom. So if there's a snake bite, either aggressor is identified, yes, if yes, then either it was venomous or non-venomous. If non-venomous, then do the wound cleaning. They will be give tetanus prophylaxis. Antivenom is not needed. If no, or if the snake is venomous, then look for the signs and symptoms, abnormal lab tests, and or the venom detection. If it's done, then do the wound cleaning, tetanus prophylaxis, give antivenom and ancillary treatment. If no, then the wound cleaning, tetanus prophylaxis, clinical monitoring for up to 12 hours will be done. In the case of dry bite, no signs and symptoms and or abnormal lab tests, then discharge the patient. Else, development of signs and symptoms will be looked for, and look for the lab test, and then do the treatment accordingly. Specific antidotes. Pitviper, for example, rattlesnake envenomation, there are 2 commercially available antivenoms that are Crofab and Anabep. And for the lapid envenomation, the coral snake, give 1 to 2 vials of specific antivenom as soon as possible. Nor the dog bite. It leads to a disease called rabies. The epidemiological triad. The agent is Lyssa virus type 1 of Rhabdoviridae family. The environment includes rapid dog population, stray dogs, bats. Hosts are the warm-blooded mammals. Epidemiology. Estimated to cause 59,000 human deaths annually is in over 150 countries, with 95% of cases occurring in Africa and Asia. 99% of rabies cases are dog-mediated. Approximately half of the cases attributable to children under 15. Major burden in Asia with an estimated 35,172 human deaths per year. Pathogenesis, the incubation period is 20 to 90 days. There are different stages. First is the virus is inoculated by bite, then replication in muscles, then there would be retrograde axonal transport. Then there is CNS dissemination. And 5th is the centrifugal spread along sensory and the autonomic nerves. There are 2 major types, encephalitis or furious rabies, the paralytic or the dumb rabies. Now the symptoms. So depending upon the symptoms, there are different stages. First, there is an incubation period, which is 20 to 90 day, and that is asymptomatic. Then there will be a prodromal period, a duration of 2 to 10 days. There would be fever, malaise, anorexia, headaches, nausea, diarrhea, emesis, agitation. And then there is a neurological period, which has a duration of 2 to 7 days, which shows symptoms of psychosis, restlessness, seizures, aphasia, hydrophobia. Basically, there are 2 different types of the neurological period. So it shows acute neurological disease, which is either encephalitic or paralytic. Encephalitic affects 80% of the infected population, with a typical duration of 2 to 7 days, and paralytic infects 20% of the infected population with a duration of 2 to 10 days. So in the encephalitic type, there would be hydrophobia, hallucinations, autonomic dysfunction, hyperactivity. And in the paralytic one, there will be flaccid paralysis in the limbs. And then there's coma and death. The typical duration is 0 to 14 days. Investigations. CSF analysis, PCR amplification, direct fluorescent antibody testing is the gold standard diagnostic method. Tissue from at least 2 locations in the brain, preferably the brainstem and the cerebellum, are taken. Skin biopsy obtained from the nape of neck, corneal impressive smears, MRI brain, EEG. Treatment. There is no established treatment. Isolation in quiet room as bright light, noise, cold draughts precipitates spasm and convulsions. Sedatives to relieve anxiety, hydration, intensive respiratory, and the cardiac support. Prevention. Health personnel should wear face masks, gloves, goggles, and aprons. Saliva, vomit, tear, urine, or other body fluids of rabies patient contain virus. Persons having bruises, cut, or open wounds not entrusted to look after patient. There is pre-exposure prophylaxis and the post-exposure prophylaxis. According to the National Rabies Control Program, so according to the national guidelines on the rabies prophylaxis, for the post-exposure prophylaxis, There must be local wound care. All white wound scratches washed with soap and water. It reduces chances up to 80%. Devitalized tissue debride. Tetanus prophylaxis given. Suturing delayed. If necessary, done after 24 to 48 hours later. Antibiotic treatment whenever indicated. Active immunization by rabies vaccine. Passive immunization by human rabies immunoglobulin. For the wound management, the do's include washed with the running water, wash with the wounds with the soap and water, and infiltrate the immunoglobulin into the depth and around the wounds. And the don'ts include do not touch the wound with the bare hand, and do not apply irritants like soil, chilies, oil, etc. The recommended post-exposure prophylaxis is administration of single dose of anti-rabies serum with course of vaccine together with local treatment of wound, which is the best specific prophylactic treatment after exposure of man to rabies. Stop the treatment if dog remains healthy or proven to be negative for rabies by reliable lab using the diagnostic techniques. Depending on the type of the contact and the exposure, the recommended post-exposure prophylaxis given in this table. So if there is just the touching or feeding of animals' legs or intact skin, contact of intact skin with the secretions, then just recommended post-exposure prophylaxis is none if reliable case history is available. If there is nibbling of uncovered skin, minor scratches or abrasions, then wound management and anti-rabies vaccine. And if there is single or multiple transdermal bites or scratches, legs or broken skin, give the wound management, rabies immunoglobulin and anti-rabies vaccine. Indication of anti-rabies treatment. If animal shows signs of rabies, dies within 10 days of observation. If biting animal cannot be traced or identified. If there is unprovoked bite, all bites by wild animals, and by the lab test, like fluorescent and rabies antibody test for Negri bodies in the brain of biting animal, positive for the rabies. Rabies vaccine. In previously unvaccinated, 5 intramuscular doses on the day 0, 3, 7, 14, 28 given. In previously immunized, 2 booster doses on the day 0, 3 given. In pregnancy, no contraindication. Glucocorticoids, immunosuppressants should not be administered during the post-exposure prophylaxis unless essential. This table shows a brief summary of different types of vaccine, which is the nervous tissue vaccine, the duck embryo vaccine, and the cell culture vaccine. The nervous tissue vaccine, the suckling mouse brain vaccine, is devoid of neuroparalytic effect. The duck embryo vaccine, now purified duck embryo vaccine, is developed improvement over adult animal nervous tissue vaccine, not available in India and Pakistan yet. Cell culture vaccine, there are 2 types, the human diploid cell vaccine and the tissue culture vaccine. Human diploid cell is safe and potent, and the tissue culture is potent and it's low cost, recommended by the WHO. There are 2 regimens. There are the intramuscular regime, the standard WHO intramuscular regime is 1 ml dose given intramuscular in the deltoid, and the 5 doses of vaccine should be given on the day 0, 3, 7, 14, and 28. The intradermal schedule, updated thyroid cross schedule. It's 2-site intradermal vaccination. 0.2 ml doses given at each 2 sites on the day 0, 3, 7, and 28. Intradermal dose is 1/5 of the intramuscular dose. Rabies immunoglobulin. Passive antibody is present 24 hours after injection. Half-life of approximately 21 days. Dosage is the human rabies immunoglobulin is 20 international units per kg, and the equine rabies immunoglobulin is 40 international units per kg. Admin as soon as possible at the same time as vaccine or up to 7 days after vaccine injection. In previously immunized, rabies immunoglobulin should not be given. Pre-exposure prophylaxis for the people with occupational or recreational risk of rabies, including travelers to rabies. Endemic areas have primary schedules consisting of 3 days, 0, 7, 21, or 28th day. After 1 month of, if virus neutralizing titer is less than 0.5 international units per ml, booster dose given, further at intervals of 2 years as long as exposed person at risk. So here's again a table which shows the time after previous vaccination, the schedule, and the recommended vaccination according to the schedule. World Rabies Day is 28th September. Now, the theories of health communication and promotion. What is health promotion? Definition. Health promotion is the process of enabling people to increase control over and to improve their health. Theories of health promotion. Selected theories and models that are used for health promotion are categorized broadly into individual models of health behavior, including health belief model, trans-theoretical model, which is the stages of change, theory of reasoned action, theory of planned behavior. The models of interpersonal health behavior include social cognitive theory, and community and group models of health behavior change, which are ecology model, proceed planning model, diffusion of innovation theory. Now, what is the health belief model? The major constructs and the components of the health belief model include the perceived susceptibility to disease, perceived severity of disease, perceived benefits of preventative action, perceived barriers to preventative action, perceived self-efficacy, cues to action. They include, the health belief model includes the individual beliefs, which has the following components as I described. And there are modifying factors which affect all these. And the action is basically the individual behavior. So all these components, they ultimately affect the individual behavior, leading to the change in the behavior. Example to be remembered is the application of health belief model in weight management. It can be used to examine factors affecting the behavioral intention of the weight management. Behavioral intention of weight management will be positively influenced by perceived threat, perceived benefit, and self-efficacy in dieting and exercise. Perceived barriers will negatively influence behavioral intention of the weight management. Perceived threat will mediate relationship between cues to action and behavioral intention of the weight management. The second example is the Michigan Model for Health, is a curriculum designed for the implementation in school using the health belief model. Theory of planned behavior, theory of reasoned action. Theory of planned behavior is basically an extension of the theory of reasoned action. So here in this figure, you can see there's a blue portion and the green one. This whole figure describes the theory of planned behavior, but the blue highlighted part shows the theory of reasoned action. Theory of planned behavior has three major components, which is the attitude towards behavior, subjective norm, and the perceived behavioral control. While the theory of reasoned action has it shows the linkage between the attitude towards the behavior, subjective norm, and the behavior intention. So these three components, they basically affect the behavior intention and then ultimately affecting the behavior. Examples. There is 1 to 3 PAP, easy steps to prevent cervical cancer, a cervical cancer prevention program designed for women in rural Kentucky. The program component includes strategies to increase knowledge and modify attitudes, beliefs, and behaviors using the theory of planned behavior as a guide. And the step SMARTER is a health promotion program implemented in rural Southwest Virginia. The goal of the program is to decrease sugar, sweetened beverage consumption among adults. Trans-theoretical model. So this model is also known as the stages of change and the process of changes. There are 6 major stages of behavioral change model. These are pre-contemplation, contemplation, preparation, action, maintenance, and termination. So these are the major 6 stages or the components here. The limitations of the model include, it does not consider environmental factors, social determinants. It doesn't focus on the focuses on the primary prevention, reducing risk, whereas preventing risk. May not be applicable to specific populations, complex health behaviors, population health interventions. Ecological model. Ecological model, effective interventions must influence multiple levels because health is shaped by many environmental subsystems, including family, community, workplace, belief and tradition, economics, and the physical and social environment. So it influences at different levels, which are intrapersonal, interpersonal, institutional, community factors, and the public policy. The intrapersonal include knowledge, attitudes, behaviors, self-concept, skill, and so on. The interpersonal processes include, and the primary groups include formal and the informal social networks and social support systems, including family, work, group, and friendship networks. Institutional factors are social institutions and organizations, Community factors include relationships among organizations, institutions, and informal networks. And the public policy includes local, state, and national laws and policies. Examples of ecological model, CDC's colorectal cancer control program and the Project HEART Health Education Awareness Research Team used an ecological model to design a health promotion and disease prevention program to address cardiovascular disease risk factors. The project uses a community health worker promoter model to provide services. Now, the social cognitive theory. This theory has following basic components, which are reciprocal determinism, behavioral capability, expectations, self-efficacy, observational learning, and reinforcements. Different definitions are given here. So social cognitive theory is basically Bandura's social cognitive theory. So this emphasizes on the reciprocal influences of behavior, environment, and personal cognitive factors. The examples include healthy relationships, a program implemented by Chattanooga Cares is a small group intervention for people living with HIV/AIDS. The program is based on the social cognitive theory. The limitations of the theory include it is complex and difficult to operationalize, does not focus on emotions or motivation, focus on one or two constructs while ignoring the others. Diffusion of innovation. The brief description is that innovation refers to a concept, behavior, or technology that is new to an individual. Diffusion takes place in stages: awareness, implementation, and maintenance. So the key components include relative advantage, compatibility, complexity, trialability, observability, linked to the behavioral intention and attitude. The diffusion takes place in stages. These stages may occur through formal and informal channels. Some people naturally adopt innovations much earlier than others. Attributes of an innovation affects willingness to adopt it, and these can be manipulated. The proceed model. It has 9 phases. The phase 1 is the social assessment phase, which basically focuses on the quality of life. The phase 2 is the epidemiological assessment of health. And then the phase 3 is the behavioral and environmental assessment. Phase 4 is the educational and the ecological assessment of the predisposing factors, reinforcing factors, and the enabling factors. And the phase 5 is the administrative and the policy assessment. Proceed ends here, and the proceed starts on the phase 6, which is the implementation phase. Phase 7 is the process evaluation. Phase 8 is the impact evaluation. And phase 9 is the outcome evaluation. Application of proceed model includes there are different applications enhancing the community participation, comprehensive school health education, influencing health worksite culture, planning multiple channel interventions, and so on. The strengths include it is popular in most research model, in existence for 4 decades, very comprehensive. And limitation of the model, the initiation of the model utilizes community inputs and participation, and phased evaluation is a very strong feature of the model. Limitations include it's too comprehensive, requires heavy financial and human resources input, mixture of several theories, and comparative studies lacking. Behavioral change communication in health promotion. It is an interactive process with communities to develop tailored message and approaches using a variety of communication channels to develop positive behaviors, promote and sustain individual, community, and societal behavioral change, and maintain appropriate behaviors. The steps include analysis, strategic design, development, and testing, implementation, monitoring, evaluation. Uses are it is used in anti-smoking, breastfeeding, nutrition, HIV/AIDS control, MCH, and drinking prevention. Information, education, and communication. A public health approach aiming at changing or enforcing health-related behaviors in a target audience concerning a specific problem and within a predefined period of time. Approaches include diffusion theory, social marketing, behavior analysis, instructive design, and anthropology. Health communication is defined as the art and technique of informing, influencing, and motivating individual, institutional, and public audience about important health issues. The communication theory is a hypothesis that describes a model of system of information transfer consisting of a source of information, the sender, a transmitter, a communication channel, a source of noise, interference, a receiver, and a purpose for the message. Basically, the Shannon-Weaver model, which has the following components as I described earlier: the information source, transmitter, channel, receiver, destination, noise source. Different theories of communication are electronic, social, and rhetoric. Now the recent advances. First, WHO guidance on snake bite treatment published. The WHO has published the first in a series of WHO public benefit targeted product profiles, TPPs, for snake bite treatment in order to improve the quality of antivenens available in the market. This is the first ever guidance to improve the quality of such products. The TPP document that provides regulators, manufacturers, researchers, and procurement agencies with essential information about the minimum and the optimum characteristics of specific products. Pakistan joins FAO program for elimination of rabies. Pakistan has joined a program being carried out by the Food and Agriculture Organization of the United Nations for the strengthening capacity towards the rabies elimination in Asia. To achieve the target zero rabies transmission by 2030, the countries implemented the IBCM system. Behavioral change communication, past, present, and future. The article emphasizes on the behavioral change communication aids in the prevention of both communicable and non-communicable diseases in clinical strategies and public health. Emerging and re-emerging infectious diseases in the future need to be tackled by developing behavioral community through effective BCC strategies. Now the MCQs. First MCQ. Ali is a resident of Balakot, a highly mountainous area with lush forest. He comes running to nearby clinic with the complaint of snake bite half an hour ago. Only few medicines are available at the clinic. If someone is bitten by a snake and doctor can't get help right away, what first aid should be given? A. Keep the bite above the level of the heart. B. Clean the area with the chilies and water. Apply pressure at the bite site with a pressure pad. D. AST along with the NSAIDs. E. Apply electric shock or folk therapies. Anyone?
A.
C.
Yes, it's C.
A.
Second, Mr. Johns lives in North America, where most snakes are not venomous, but those that are venomous include the rattlesnake. Approximately 20% of the population there has the history of snake bite. What can you do to lower your risk for being bitten by a snake? A. Catch any snake you see on a hike and move them off the trail. Kill any snake you see on a hike. C. Wear high top leather boots when walking through or working in areas with dense vegetation. D. Walk freely on large grasses. E. Lie down or sit down in area where there might be snakes.
C.
Yes, it's B. Third, Mr. Askar died in a village in Pakistan with the history of snake bite and hour after he presented Mayo Hospital. The friend gives history that the person is bitten by a big snake having short fangs on a baja. That was most likely cobra type. The death happens because of the failure of which of the following system? A. Cardiovascular, respiratory. C. Renal. D. Neurological. E. Circulatory.
A.
It's D. Neurological. 4. A patient presents to OPD with history of dog bite by a stray dog. After complete history, doctor examined the patient thoroughly. Which among the following is not among the symptoms of rabies? A. Hydrophobia. B. Aerophobia. C. Constricted pupils. D. Sears. E. Agitation.
B.
It's C.
C.
Yes, it's C. Fifth, a traveler comes to your clinic after getting 2 doses of vaccine 6 months ago. And next week is traveling to endemic area for rabies. What should you do? A. Start the scheduling again and get him to cancel his trip. B. Give 1 dose of vaccine and assume he has good cover. Order the same vaccine he used. D. Assume he already has enough cover. E. No intervention. It's B. Sixth, a boy complained of unprovoked bite by local dog in the community. The dog was later caught by the local animal authorities and appeared to be healthy. The most appropriate course of action would be A. Give post-exposure prophylaxis to the bitten person with cell culture-derived vaccine. B. Withhold vaccination. Keep the dog under observation. C. Test the dog for rabies antibodies. D. Immediately carry the euthanasia of the dog. E. No intervention needed.
B.
A. It's A. 7. A 44-year-old man has been bitten by a wild dog, resulting in multiple deep lacerated wounds on his left leg. He has a record of previous complete pre-exposure vaccination against rabies that he had taken 5 months back. He presents at the district hospital where you provide him with the appropriate management, which should all include except A. Washing wound with the soap and water. B. Giving rabies vaccine booster on day 0. C. Rabies vaccine booster on day 3. D. Apply pyridine on wound. E. Rabies immunoglobulin on day 0.
D.
E.
It's
A.
E. And the answer is E. Eighth, matching appropriate strategies and intervention with projected changes and outcomes occur during which phase of proceed? A, second, B, fourth, C, fifth, D, eighth, E, sixth. Anyone? It's D. Ninth, the theory of planned behavior includes the concept of perceived behavior control. Which of the following statements should be said by someone who is speaking about their self-efficacy? A, I think that being healthy and looking good are desirable attributes. B, I am confident that I could quit smoking if I wanted to. C, that seeing to exercise is within my control. D, option B and C are correct. E, all of the above.
B.
D. The answer is D. 10th, which of the following statements could be an example of the normative belief within the context of theory of planned behavior? A, wearing a seatbelt, then driving. B, expecting to have my blood pressure measured when I visit my physician. C, doing what my peers suggest to me about my health is important. D, having my family and friends think that I should go on a diet. E, being healthy is a desirable outcome of quitting smoking.
E.
E.
Yes, the answer is D. Here's the key of the MCQs and the references for the presentation. Thank you so much, everyone, for your time. Here's the link of the YouTube channel. All the presentations are uploaded there. You can always like it. You can check them. Just like and subscribe them. Thank you so much for being patient and listening.